Hello and welcome to Mississippi Inside. I'm Melanie Christopher in This Week for Byron Brown. Thank you so much for joining us. Now this week, healthcare in Mississippi is at a crossroads. What can lawmakers do in the 2023 session to shore up the struggling hospital network and keep qualified medical professionals here in the numbers we need? The president of the Mississippi State Medical Association, Dr. John Cross, joins us with the physician's perspective. Also, education advocates say schools need help too. We'll hear from the Mississippi Association of Educators as they take their case to the state capitol. And we're going to recap some big announcements in this year's state elections, including a Democratic contender for the governor's office. That's all ahead this Sunday on Mississippi Insight. It is no secret that the Magnolia State faces some serious challenges in our healthcare networks. Hospitals statewide are at risk of closure. Tens of thousands of people lack medical insurance, and it remains a struggle to keep qualified healthcare professionals in Mississippi. A statement earlier this month from the Mississippi State Medical Association underscores these challenges. Quote, "The lack of access to health care for many Mississippians is currently a crisis, not a new crisis, but one that has been fermenting and is getting worse. As hospitals close across Mississippi, access to life-saving medical care becomes a real threat to all Mississippians. While the debates rage on as to why our hospitals are closing, the immediate crisis progressively engulfs us." One of the people behind that statement joins us this morning. Dr. John Cross is the recently elected president of the Mississippi State Medical Association. He's a board-certified internal medicine physician, a fellow of the American College of Physicians, and a native of Brandon. And Dr. Cross, we welcome you to Mississippi Insight.
Thank you. Thank you for having me.
First question, how did our healthcare network get to this point?
Well, first, I'd like to start off by saying that rural hospitals have a problem nationwide. And even the American Medical Association has mentioned that our healthcare system needs a big fix. You know, we're in a broken system. And that's come from years of pendulum swings back and forth between fee-for-services and different ways that reimbursements are made for physicians and for hospitals. But over the last couple of years, hospitals have faced an increased demand. With the COVID pandemic came on, they suddenly saw their reimbursements going down and overhead costs going up. You know, we all heard about toilet paper prices going up.
Right.
Well, as you can imagine, in hospitals, that works the same way. So staffing, respiratory therapists, nurses, physicians, were all being offered higher salaries for metro area type hospitals, which put more and more pressure on the rural hospitals. From a reimbursement standpoint, they have four main ways that they get their reimbursements. One is federal funding from Medicare. That's for usually adults 65 and over. State funding on Medicaid. And then there's uncompensated care, which usually doesn't have any kind of reimbursement to it. And then they have the private insurance. And so when COVID happened, these smaller community hospitals were taking care of their community. When patients would come in, they would give them care the way that they saw fit. And many times that resulted in some loss of their savings that they had built up before COVID. And so now we're at a point where we're at a financial crisis. And we heard statements from Greenwood in the past couple of months, also in Greenville. Our state health officer, Dr. Dan Edney, mentioned that over half of Mississippi's rural hospitals are subject to financial concerns and could fail. And we've seen in other states that a lot of times when a hospital does close, it's difficult to reopen that building. Building codes have changed. The amount of upkeep to keep those structures going is difficult.
Okay, well, all of that makes really just perfect sense. I had not thought about the building closing and then having to reopen either. That's new to me. Well, the Mississippi Hospital Association says hospitals statewide now sustained almost $600 million in uncompensated care costs, which you talked about, in 2021 alone. So those costs continue to build up in 2023. How worried are you personally about hospitals closing and the impact that could have on health care access?
Well, we always want to advocate for increased access to our Mississippi community. And so what happens is in our healthcare system, we are dependent on each other. When a hospital closes in the Delta, that pushes more patients toward hospitals in the metro area. And so we are concerned about crowding in hospitals, even in the metro area. Not only is it bricks and mortar for hospital rooms, it's also staffing like nursing, respiratory therapists, other therapists to help operate these hospitals as well.
Let's consider the people who deliver health care in the state. You just mentioned some, the physicians, the nurses, the lab techs. Are you concerned about our ability now to attract and retain those healthcare professionals with this crisis?
Well, we always promote the physician-led team, the healthcare team, and that's having a physician in charge to kind of oversee what's going on. And those can help the doctor extend to see more patients, whether that's a nurse or respiratory therapist or physical therapist. And yet we are concerned because for the past 20 to 30 years, we've worked to put doctors in rural areas. You know, the legislature has allowed us to have a rural scholars program, which is a scholarship to go to medical school if you're willing to practice when you get out. We've also opened up residency programs in Greenville and some of these other places in the Delta. So we need places for those residents to train because we feel like when a resident goes to a small community, then they'll fall in love with it. And they'll become ingrained in that community and they'll stay in that community. So we have an increasing number of graduates, both from University of Mississippi Medical Center as well as William Carey School of Osteopathic Medicine, that we want to retain and keep here in the state. But as those rural hospitals close, that kind of goes against what we've been working forward to all these years.
There'll be no place for them
Right.
to go. Your group statement earlier this month was directed in large part to lawmakers and state leadership. You offered 5 specific steps that our politicians should take now. Now, we're going to take them one at a time now. Number 1 was raise the income eligibility for Medicaid. Now, that's essentially a call for Medicaid expansion, right?
Well, we like to use the terms access to care, but we do want to reward our Mississippi hardworking citizens who are working, who may not have employee health benefits, to allow them some coverage. And if you don't understand, you know, sometimes the uncompensated care, those costs the hospital will have to pass on to some private insurance payers and make those costs go up for those private insurance companies. So we're all affected. And so we think the hardworking Mississippians that may not have employee health benefits should have a way to be rewarded and have a ticket to participate in the healthcare system.
Number 2 was offset taxes hospitals currently pay. Now talk about that. What sort of taxes are you referring to?
Well, the hospitals go through a lot of different funding mechanisms, and some of that's coming from the Mississippi Medicaid Department overall to help supplement some of those service lines that are crucial for these rural areas. And so the hospitals now have acute needs and long-term needs. And so even if we were to flip the switch on Medicaid expansion today, it may take years before that funding starts coming in. So there are short-term needs there too. And some short-term tax relief would be helpful. Figuring out ways to appropriate funding, you know, with some of the infrastructure money that we've gotten from the federal government to help kind of redo some of those savings accounts those hospitals had.
Restructure healthcare delivery across Mississippi. How so?
Well, I think we should take a long look at, you know, how the population has shifted in different places in the Delta, you know, and where hospitals are needed, what kind of hospital in order to allow the right access, you know, and the right services to the right patient at the right time. You know, we want someone to be able, if they're having chest pain in the middle of the Delta, to be able to get to a healthcare facility within a reasonable amount of time. But we may not need a cardiologist in every small town in the Delta, right? So we need to kind of take a look and see how populations have shifted, to see where hospitals are needed. And we feel like we can get a collaboration between, you know, lawmakers, hospital administrators, community and business leaders, and also physicians to take a look at how that works. You know, we've worked for years on a stroke network and a heart attack network so that you can get rapid response time if some emergency like that happens. You know, and that's at risk if you start closing Delta hospitals.
Let's continue with these MSMA recommendations. Number 4, consider Arkansas's model to provide access to care for working Mississippians through the purchase of private insurance for qualified recipients. Now, why should we consider this in Mississippi?
Well, as you know, there's 11 states that have not yet accepted the Affordable Care Act. And one of those states that has accepted it is our nearby neighbor, Arkansas. And they've slowed the number of rural hospital closings since they've joined in what they call a waiver program. And so what they did is they were allowed to get a waiver where they get the 90% of federal funding from the federal government and use some of that money to increase that 10% obligation from the state. And so there are some creative mechanisms that we can look at in other states to help that work. Because if you can create that other 10%, that takes the burden off the Mississippi taxpayers, but allows that 90% of federal money to come into the environment. And projections have gone anywhere between $900 million to $1 billion of federal money coming in for Mississippi. And right now we're paying into that affordable care system, and we're not getting the reimbursements and benefits from it.
All right, that does seem something that they should be considering then.
Right.
In the legislature this year. Number 5 is enhance preventive care measures for all Medicaid recipients by implementing an accountable care payment model. Can you explain how that works?
Right, so right now Mississippi Medicaid, they have a lot of patients they have to deal with, and we don't want to throw money at things that aren't working well. And so what we do on the Medicare side is we have affordable care organizations, accountable care organizations. One great example of that is Hattiesburg Clinic, and they're leading the nation in Medicare quality metrics. And so what Medicare does is they give you a certain amount of money, and for those clinics that show quality and improved outcomes, well, they get a bonus, a reward. While the clinics or physicians or the patients that aren't showing that improvement, they get some reductions. And so that drives the physicians and the clinics to promote quality and access as well. And we feel like we could help Medicaid kind of be more efficient with their delivery model.
And you said Hattiesburg has the #1 in the...
Hattiesburg Clinic has been a shining star of how they've gotten their quality metrics to show that you can give efficient and quality care at the same time.
All right, very good. There's a big debate about expanding Medicaid in particular. The governor in particular has steadfastly refused to consider it. He doesn't even call it that. So have key leaders in the House, they've gone along with that. Are they wrong about that?
Well, I think you have to always look at the time of what's going on. And so the position that we're in now, I think the temperature in the room has changed a little bit because we're coming out of that COVID pandemic. We've seen those hospital savings accounts being depleted. We've got more and more Mississippians returning back to work and that need care. So I think business leaders are starting to notice that we need health care for our employees. More people are starting to notice the benefits of this program.
Dr. John Cross with the Mississippi State Medical Association, we thank you so much for your insights. You've really shed a lot here on things that can be done and need to be done.
Thank you for having me.
We thank you so much. We'll be right back. Education is another top-line issue for lawmakers this session. The Mississippi Association of Educators visited the Capitol Tuesday to speak to lawmakers about what Mississippi schools need. And the #1 thing educators say they want is more funding for the Mississippi Adequate Education Program. It's far from clear, though, that fiscal conservatives in House and Senate leadership are willing to consider that. 12 News' Richard Lake had a chance to talk with Erica Jones, she's the president of the Mississippi Association of Educators, about her group's priorities and other proposals in play at the Capitol this year.
The best thing that we can do for our MAE members as well as our educators and our students in the state is to come to the Capitol and advocate around issues that are concerning our public schools here in Mississippi.
Right. So I know, there's a lot of priorities educationally for the state. For y'all, what are y'all priorities?
Some of the issues that we're going to continue to advocate for in this 2023 session is fully funding the Mississippi Adequate Education Program. That is something that we have advocated around over the past couple of years. That's the funding system for our public schools here in the state. We're going to continue to work with our legislators here at the Capitol, ensuring that we receive the funds that our educators need in order to go into our classrooms each day to be successful.
Could you kind of give an overview of where MAEP is right now, where it needs to be?
Sure. One thing that we know about MAEP over the last couple of years, it has not been fully funded. Those funds are needed in order for our classroom teachers to receive the materials they need each day to go into the classrooms. This is something that we've spoken with our legislators about over and over again. These are some of the same ideas that our parents have advocated around as well. Here at MAE, we're going to continue to work on getting those funds for our public schools in the state.
What have you been hearing from teachers, ahead of this meeting, and just what are, teachers in classrooms saying?
So yeah, our teachers across the state have really appreciated the work that our legislators did around the teacher pay raise that was implemented last year. What we know, that was one of the largest teacher pay raises that we've received. One thing that I've heard from educators is that they're continuing to work hard each day in our classrooms, and they're going to continue to do that as we think about our students and how important that is to the citizens here in Mississippi.
Right. Lieutenant Governor Delbert Hosemann has, floated the idea, that he's going to at least pursue a year-round public school calendar. How does that, for educators, what does that mean for you, and would y'all support that?
We are eager to speak with the Lieutenant Governor around a year-round calendar. What we know is that we already have districts who have implemented a year-round calendar, and it has success with that. Our educators have expressed to us that they are interested in hearing what the Lieutenant Governor has to say about a year-round calendar, so we are ready when he is ready to have that conversation.
All right. You have anything planned today to speak to him about?
Oh, yes. Our teachers who are here with us today are going to have conversations around not only a year-round calendar, but also issues such as community schools and trauma-informed classrooms with our legislators here in the Capitol.
Right. So, of course, it would take more resources in order to keep schools open year-round. Could you kind of go into that a little bit more? Right now, could a lot of Mississippi districts, withstand that kind of open schedule?
Sure. It is our desire and our wishes that the legislator, as well as our Lieutenant Governor, will have conversations about what does funding look like when we think about a year-round calendar. I've heard educators express the concern whether or not there will be extra funds needed for like buses and cafeteria staff. So those are some of the conversations we're looking to have with the Lieutenant Governor and other members of the legislature.
Anything else you want to add?
Our educators are really excited about ending this school year strong. We are here to advocate about having the best public schools here in the state.
That's Erica Jones with the Mississippi Association of Educators. Up next, the 2023 state election season is shaping up. We'll recap some key announcements when Mississippi Insight continues.
And if you make me your governor, I promise you this, I'll never forget who I am, where I came from, or who sent me.
Brandon Presley has made it official. The Public Service Commissioner for the Northern District is running for the governor's office. He's currently in his fourth term as Public Service Commissioner. The former mayor of Nettleton will run as a Democrat. Right now, Presley faces a single contender for that nomination, Gregory Wash. If he wins the primary, he'll go on to face the Republican nominee in November. Republican Governor Tate Reeves has already said he will run for re-election. State Auditor Shad White has announced that he's seeking a second term after filing qualifying papers with the Republican Party. During his first term, White and his team investigated the state's largest ever welfare scandal and recovered misspent tax money. He has served as state auditor since 2018 and is a native of Jones County. And Shawashki Young is running again. This time he says he wants to run against incumbent Michael Watson for the office of Secretary of State. This is the Democrat's second bid for public office in the last year. He lost the race for the 3rd Congressional District to Republican incumbent Michael Guest in November. Young made his campaign announcement in Jackson, pledging to clamp down on corrupt charities in the state and to broaden voting access.
Mississippi does not have to be known as a voter suppression state. We can and we must change this outlook in our actions and our reputations, which also affects our business endeavors. We need early voting in this state. We need online registration in this state. We need more assistance and proper guidance to our circuit clerks to maintain the voter rolls and get an effective website that directs the public where they can get information.
The state Democratic Party has not said whether any other candidates have filed a bid for the position, and Secretary Watson has yet to announce whether he will seek re-election, but his press office tells us he'll make that announcement soon. And the man who Young lost to in November will join the U.S. House Appropriations Committee. Congressman Michael Guest was recommended by the Republican Steering Committee. That recommendation will now go before the Republican Conference to be ratified. The Appropriations Committees in House and Senate write the legislation that allocates federal funds to the numerous government agencies, departments, and organizations each year. And as Congressman Guest noted, Mississippi representatives have had a seat on the House committee ever since the late Jamie Whitten joined in 1949. We're back in a moment. Our thanks to MSMA President Dr. John Cross for joining us this week. We'll be back next weekend with more of the political and current affairs coverage that you demand. I'm Melanie Christopher. From all of us here at 12 News, make it a great weekend.